U.S. Senator Bill Cassidy thinks Louisiana Surgeon General could help people get the COVID vaccine without needing a prescription.
Sabrina Wilson explains how.
With the firing of the CDC's new director, resignations by some high-level CDC staffers, and difficulties some people now face in getting the COVID vaccine, some states are forming alliances to make their own vaccine recommendations. Louisiana is one of the states where CVS says it will require prescription before giving the vaccine. So I put this question to Senator Bill Cassidy of Louisiana, a medical doctor.
What should the state do?
You know, the Surgeon General can write a prescription, or a physician with the state government, that would allow anyone who desires the vaccine to go to the pharmacy and get the vaccine based upon the prescription written.
And Cassidy says it's something that's happened before with a goal of saving lives.
That was done during the worst case of the fentanyl epidemic, where the state medical director or HHS secretary wrote a prescription that anyone could go get Narcan to reverse somebody based upon that prescription, and that saved lives.
The FDA limited access to the updated COVID vaccine to people 65 and older and younger people who have an underlying condition that puts them at risk of serious complications from COVID. Here was Cassidy speaking to HHS Secretary RFK Jr. last week.
I would say effectively we're denying people vaccine.
Senator Cantwell.
You're wrong.
Florida is ending all mandates for school kids to be vaccinated, something President Trump questions.
Well, I think we have to be very careful. Look, you have some vaccines that are so amazing. The polio vaccine, I happen to think, is amazing. A lot of people think that COVID is amazing. You know, there are many people that believe strongly in that, but you have some vaccines that are so incredible.
Cassidy says,
yeah, that's a bad decision, and within the year there'll be children who are infected and children who die.
He says needing a prescription for the COVID shot is problematic.
We're driving up the cost for a patient. I'm a doctor. I want to make it as least expensive, as easy for the patient to get what the patient needs. So if there's a blanket prescription written out of state government to every pharmacy that if Sabrina Wilson wants to go get a COVID vaccine, she just says, oh, don't worry, it's covered by that blanket prescription, you or anyone else, then why not do that?
I reached out to the Louisiana Department of Health in hopes of getting a response from the Surgeon General for this story, but so far have not heard back.